Hi, I'm Pat Langley. I'm a dentist and I'm one of the co-founders and chief executive of Apolline. We set Apolline up in 2010 to help and support dental practice teams in all matters relating to regulatory compliance. We saw the Cqc coming and we thought, we think actually the profession is going to struggle with this, and Apolline was born. Now in this short video I'm going to talk to you a little bit about the Cqc's new fundamental standards. I'm going to talk to you about your get out of jail free card, significant incident reporting, and then just finish with a little bit about what the Cqc expects. The focus with the new fundamental standards has shifted. Not much, but it is a significant shift. So there's a strong focus on consent, there's a strong focus on safe care and treatment, and there is a new regulation called duty of candor. Now, all of those regulations or standards have prosecutable clauses related to them. There's a new requirement to have a demonstrable governance system within the practice as well. And those are new things that the Cqc is going to focus on. Duty of candor, I think, has alarmed a lot of people, but all it really means is you have to, when things go wrong, as they do, you have to tell the truth and apologise to the patient. Well, I think we would all say that that's a very good thing to be doing. So nothing to be feared there, it's just a very simple requirement. Now, one of the most important things you can do is to record significant incidents, things that happen in the practice, and be able to demonstrate that you are doing everything you can to avoid things that have gone wrong, going wrong again, and to repeat good practice. Now that makes a lot of sense from a business perspective as well, because actually things that go wrong take up a lot of time, they create stress, they create complaints. So I think that significant incident recording and reporting and being able to demonstrate that you act on your findings not only plays a very big part in demonstrating compliance, it also makes a lot of sense. And that should make your practice safer, it should make it less prone to complaints, and it should make it more efficient by saving you time. Now, what should you expect from a Cqc inspection? Well, the Cqc focuses on outcome for patients. So what you should do is also focus on outcome for your patients. Now, outcome is made up of structure and process. So outcome is what happens in your practice. Structure is all the bits of kit, all the items, all the instruments, all the equipment you have, perhaps the emergency equipment. Process is how you use all the pieces of kit, and outcome is what actually happens as a result of using the pieces of kit and following your policies. Now, Cqc focuses on outcome. What does that mean? Well, let's take an example. Let's say we're talking about emergency procedures. Well, structure is your emergency drugs and your equipment. Process is your policies, your training, and your protocols. Outcome is what actually happens if a patient collapses in your practice. So obviously you need all the pieces of structure in place to make sure you get the right outcome. You need all your policies in place to get the right outcome. Bear in mind though that the thing the Cqc is going to ask you about is what happens as a result of having those policies and protocols in place. Thank you for listening. My name is Pat Langley, I'm from Apolline, and in the next short video we're going to look at how best to prepare for inspections and how Apolline can help you.